Welcome back to OpenLine. We are talking about mental illness and the homeless community. We just saw a short film from our News Channel 5 photographer Nathan Sharkey. We have with us Dr. Sheryl Fleisch, who is the psychiatrist, founder, and director at the Vanderbilt University Medical Center's Street Psychiatry program. Now, in this film, you highlighted three different people. There was somebody who had just gotten out of prison, somebody who had moved here from out of town from New York, and a vet who, I don't know if he was happy living, but I mean, it was an interesting three groups. I guess I'll ask you, how would you characterize, how do those three people represent what you see out there?
I think that there are many different faces of homelessness, and it's very difficult to place people in different categories, but I think a lot of people are really just like us. I think the woman is somebody who we would identify as having a severe and persistent mental illness. She's somebody who really lacks a lot of insight into what is going on with her. She moved here from New York. She has, I believe, a husband and a child who are currently in New York, and she struggles with a lot of symptoms of psychosis and hallucinations and delusions, and because of some of those things, that is why she continues to be homeless at this time. And I think with the guy who had just gotten out of prison, he really struggled due to just coming out of prison, beginning to start his life over again. He relapsed, he started drinking again, but then what you saw in the film was that it just so happened that particular day he decided that he wanted to go to rehab, and so we were really able to assist him in engaging in that process. And then with the veteran who you followed in the film, we've known him for the last couple of years, and he is really interesting because he is an individual who is actually in a very small proportion of the population of individuals who are struggling with homelessness. Probably about 10% of individuals who are homeless, they have a preference to remain on the street. Probably about 90% of individuals would prefer to be housed, but are just unable to be able to engage in the housing process because of so many barriers that exist because of lack of affordable housing and lack of being able to engage in those services. So he really likes his life. He has been able to do carpentry and many other things, and he feels like with the money that he currently has, he would be best living outside than living in the housing that he would be able to get with his money.
And was he someone who, you know, had a prior life? I mean, did he work a 9-to-5? He was a veteran, right?
Yeah.
But did he work a 9-to-5 job, and then he just decided, you know what, I'm just going to go live this way? Or do you know about his
So
past?
I don't know his entire story, mostly because he is a little bit closed up with certain things that he's willing to reveal, but he has served. And he did previously work a carpentry job, and he has some savings. And because there really isn't affordable housing in Nashville, that would be about 30% of your income. And if your income while on disability here in Nashville would be about $735 a month. So 30% of that would be about $230, $250. And we don't have any apartments available in Nashville that are that much. So there's nobody who's currently obtaining disability that would be able to afford that. There are actually only 12 counties in the entire nation that currently have what is considered affordable housing.
And how often do you go out?
So we actually go out on the streets every Wednesday. It's me and 3 of our psychiatry residents and usually a medical student that goes out with us. And then we have a hospital-based program that includes me and a nurse practitioner. We also have a housing navigator and a disability coordinator. And we have a larger program called our Homeless Health Services program. And so we're the only hospital in the country actually that has an in-house homeless consultation service where we're dedicated to serving individuals who are struggling with homelessness.
And how often do you see the same people? Are they in the same spots generally, or is it you just don't know who you're going to see when you go out?
That's a great question. So sometimes I always say that it's as if you go to a campsite, and if you walked into your own home and somebody, one of your family members shifted around your entire room and everything that you had, and it was as if you walked into a totally renovated place. That's what it's like for us when we go to campsites. Sometimes we went there as if we were to see one person, and when we got there, there is a completely different campsite with totally different people that we didn't think we were going to see. Other times, the same people, like the guy who is a veteran, he's been at the exact same spot for the last 2 years. We always know we're going to find him there. So different spots have different people. There's a different infrastructure, different areas. So you just kind of have to be prepared for whatever you're going to see.
How did you know about this, Nathan? I mean, how did you know about what she was doing and kind of, you know, what, I guess, how did you know about all this?
Well, my wife actually went to school with her at Vanderbilt, and she gets probably, I think, one of these alumni newsletters or something like that.
Yeah.
And of course, Dr. Fleisch was profiled on it, and my wife was like, "Oh, I know her," and then she started reading more and more, and she's like, "You know, this is really interesting. You should kind of think about doing this as a story." And I was like, "All right, let me see this." And I read it, and I was like, I mean, I was like, yeah, it really is. It was really interesting, and like I said earlier, it's just something you hadn't heard of before, and so I reached out to our Vanderbilt's public relations, which is Kristen, and so we kind of set it up from there and tried to. We had some tough time trying to coordinate when we could all meet up, but we finally were able to do that, and it worked out pretty well.
And I bet you put in, I mean, a lot of your own time, and it's incredible. I mean, it's one thing to do a story. So your wife and I get that, you know, you should do a story. You did a film. I mean, that's great, and it's been put out there in all kinds of different formats.
The intention was actually to put it on our website, because I knew I had lots of material, and the news is great, but a lot of times I feel like we kind of just, you know, scratch the surface a little bit on topics, and so I really wanted to be able to kind of just dive in on this, and so my intention was to put it on our website, and it was almost finished, and I walked by my news director's office, Sandy Boonstra, great. She's a great person, and I said, "Hey, just to let you know what I'm doing here. This is going to go on the website. It's pretty hefty. It's like 8 minutes and some change." And she said, "Well, let me take a look at it." And she gave me an email like later on that day. She said, "Let's just run this whole thing in the newscast," which is 8 minutes on a piece is very rare. So
no, she's never done that with investigators. I'm just kidding. I don't know. No, that's very rare. That's really rare. I agree, and it speaks to her commitment to this issue.
Yes,
and that's really great.
Yeah.
All right, I want to take some calls here. Let's go to Grace. Hello, Grace. Grace, are you there?
Sure.
Go right ahead.
Hi. I was curious to know what programs that these folks, in combination with Vanderbilt, might be working on in terms of children and homelessness.
Children and homelessness. Yes. Okay. How much do you see of that, and what programs are there?
Yeah, that's a great question. So in terms of in children that we actually see on the street, it's very rare that we actually see children under 18 on the street. There have only been about 2 times that we've actually seen children on the street, and in those circumstances we had to call the Department of Children and Youth. But in terms of how we work with children who are struggling with homelessness, we actually work with Oasis Center, which is a shelter that serves youth and young adults under 24. And we currently this year have piloted a psychiatry actually program at Oasis. We have a psychiatry resident that's there every Wednesday afternoon. So keeping with our Wednesday outreach day, and she is working there now in a shelter-based program. And so we see young adults 18 and older there. And we hope in the future to be able to expand that programming to youth under the age of 18. So we're really happy to begin that partnership with them.
As our city grows, are we seeing the homeless population grow?
Yeah. Absolutely. So I think in terms of the numbers, the last what is called a point in time count, which is where every January we go out on the streets in the middle of the night and we actually manually count everybody who is homeless. In years past, the number has been approximately 9,000 individuals who are homeless in the state of Tennessee, and in Davidson County it's always right around 2,000 to 2,300. All of us and everybody nationally generally thinks that this is a pretty gross representation. It's usually probably about 50% more, because when you're physically out there counting somebody, they literally may have just like left for a few minutes while you're actually counting them. It also doesn't include actually hospitals or jails, and so there's some issues in terms of how we actually do the counting, but it does include people who are sheltered or in safe havens. But in terms of growth, Nashville actually was one of the highest increases in chronic homelessness in 2016, and it's unclear exactly why, but it is a place that a lot of people want to come to, and so homelessness in general nationally is declining, but in Davidson County we've actually seen an increase. And
Grace, and I guess we have to but Grace is mentioning children. Obviously, each one of the people that were profiled in the film, they were individuals. And I'll ask this and then we'll take a break. How often do you see, if not families, just a family unit? You know, maybe husband and wife, or mother and children. Is it mainly individuals, I guess?
So in terms of statistics, there are more individuals than family units. However, we see a lot of units. People like a husband and a wife or partners together. And what makes it really difficult and what keeps people unsheltered, so staying outside instead of in sheltered communities, is that our shelters only allow either a women's shelter or a men's shelter. So there are no sheltered communities in Davidson County that will allow a family unit without children. And so that keeps a lot of people outside.
All right, we're going to take a break. If you're on the line, hold on. If you want to call, there's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.